Thank you, Mr. Speaker. Mr. Speaker, I'm standing here today to voice my support on the extension of the state of emergency. On January 22nd, Ontario made COVID-19 a designated reportable disease under the province's public health legislation. On March 17th, our province declared its first state of emergency. This decision was not made lightly. Immediate action was made to prevent and reduce the serious harm COVID-19 was having on the lives of Ontarians and our public health system. We declared an emergency because we only had one goal in mind. We, as elected officials, as the provincial government, need to protect the health, safety, and welfare of the 14.5 million people in Ontario. We also took this extraordinary measure because we thought of our health sector, our frontline and healthcare professionals, who are risking their lives every day, leaving their families and working long hours in hospitals, senior homes, long-term homes, and congregate settings to help Ontarians who are affected by this virus. COVID-19 is a ruthless virus that is affecting everyone, particularly our vulnerable population. We are seeing how long-term homes has been affected by COVID-19. Our province makes fast and rapid decisions, and we are gradually seeing outbreaks and situations in long-term homes improving. As of June 22nd, 66 long-term homes are with an outbreak, and we have 247 long-term homes with resolved outbreaks. Since January 15th to June 22nd, which was yesterday, we have completed well over 1 million tests. The actual number is 1.2 million. We are ramping up testing, and we are gradually seeing outbreaks and situations in long-term homes improving. But we have to do more, and we must do more. The extension of state of emergency will continue to provide health care providers the ability to ensure resources and personnel are directed appropriately throughout the healthcare system. Our decision to declare the province the state of emergency and the actions to extend it has been acknowledged as the rightful choice. On April 28th, the Financial Accountability Officer published a report on COVID-19 and our province hospital capacity. The report highlights the decisions made by the provincial government has been established based on available data for Ontario, evidence from other jurisdictions, and best practice in public health. The report acknowledges that Ontario has been able to expand hospital capacity, allowing for us to have sufficient resources to support a potential surge of COVID-19 patients requiring crucial care or critical care. Furthermore, the report indicated that the early implementation of lockdown measures in our province has contributed to avoiding much worse outcomes. That had these measures to limit the spread of the COVID-19 virus had been implemented 5 days later, the number of concurrent critical care patients will have been over 1,000. that is over 4 times greater than what has occurred as of April 23rd. Making the choice to declare our province a state of emergency was not done so easily, but it was and will continue to be the right choice, Mr. Speaker. We see communities, families, organizations, and businesses complying to the medical advice and emergency orders. Their selfless actions are the reason why Ontario is able to be at the position they are today. Mr. Speaker, COVID-19 is a ruthless virus. It is affecting our family, our friends, our loved ones. And the health of Ontarians is our top priority. That is why, since day one, Ontario worked with partners in the healthcare system to implement a robust plan to monitor for, detect, and if needed, isolate any cases of the virus. We knew transparency was important. Everyone in Ontario deserves to know the current situation of the province. This is why we have held regular media tech briefings, had daily website updates, and offered multiple briefings to members opposite. Knowing that the situation is constantly changing, we continue to provide updates on the website as early as possible. Our government knew that we must increase testing. As the province is carefully and gradually reopening the economy, our government is implementing the next phase of its COVID-19 testing strategy to detect and quickly contain the spread of the virus. This includes 3 branches of testing. We are expanding testing in assessment centres. Individuals with symptoms and asymptomatic individuals concerned about exposure can go to one of the 130 assessment centres across Ontario to get tested. People will no longer need a referral to go get tested. We are expanding proactive surveillance testing and monitoring. This will allow our province to detect outbreaks and more actively monitor any spread among our most vulnerable populations in hospitals, long-term care homes, group homes, shelters, emergency childcare centres, and other shared living spaces. This branch will include the testing of symptomatic and asymptomatic frontline staff in long-term care and retirement homes, as well as working with high-risk sectors, including first responders, essential workers, and other workplaces as the economy gradually reopens. Further proactive surveillance testing will also be conducted in rural, remote, and Indigenous communities. As the economy is slowly and gradually reopening, we know that more proactive testing will give employers and their employees confidence as they return to work. It will fortify our alert system for any potential surge in new cases. This is why the government is working with private sector employers to deploy the appropriate models for each sector and workplace. And workplace testing will leverage private and public resources. As part of the next phase of COVID-19 testing strategy, Ontario is also developing agile testing resources. This will include the establishment of mobile testing teams that can rapidly deploy to a specific neighbourhood, regions, institutions, or workplace if there is an outbreak. to improve our case management and contact tracing. We are in process of launching a new exposure notification app that will alert Ontarians when they may have been exposed to COVID-19 and would recommend appropriate actions such as monitoring for symptoms, self-isolations, and appropriate next steps to getting tested.